We are back on Taking Care of Business, if it's okay with Clay, on Koerner Radio, News Talk 1180, 1230 KGEO, 1410 KERI, 1000 KKIM in Albuquerque, New Mexico, and now in Richmond, Oakland, and San Francisco on knookmedium.com. Our in-studio guest, Dr. Mensink from The Practice.
You know, Dr. Mensink, we've got this new program that takes effect on January 1st. It's called Obamacare. When Obama first passed this legislation, he couldn't say Obamacare enough, but unfortunately now he never says Obamacare, nor do any of the other party, the Democrats. They all refer to it as the Affordable Care Act. But in California, it seems to be working fairly well, and we have the Covered California Exchange. But your practice, called The Practice, doesn't really give some of the benefits that are needed by some employees or individuals. But I have to take into consideration that only about 35% of the population ever needs a hospitalization, and some of those don't need it. But under Obamacare, they have several different plans that are available, and they have a plan called the Bronze Plan. Now, the Bronze Plan has a $5,000 deductible, and it covers the first 3 office visits at $60 per visit. So that would be a great plan for an employee to get into in addition to the practice, so that you could take care of all the basic services that someone needs, doctor visits, prescriptions, which they do have in Obamacare under that plan also. But then they have to go into the hospital.
But Clay, just look at the cost for the Bronze Plan for prescription. The copay for a generic is $30. Our patients are buying 90% of their prescriptions for $4 or under.
Wow.
I mean, I don't want to say too much, but it's just a total. On our drug plan, we have a drug plan for $44 a month. Like Walmart has, I think, 200 medicines on their $4 Walmart drug list. I think on our drug plan we have over, I think, 969, if I remember right. But there's what's happening. Two ways people are joining us with to cover Obamacare. Many are, as you say, joining, buying the Bronze Plan to cover for that eventuality.
The hospitalization.
The hospitalization, but frankly, the Bronze Plan isn't a very good plan.
Terrible.
Right? And then they add the practice, roughly $800 a year. We cover 85% of most people's care. The second way people are doing it is, as you're well aware, people are getting killed with insurance. Many people are insurance rates going up 40 to 400%. These people are getting killed. So what they are doing is they are getting health savings accounts, which is covered under the Affordable Care Act. They're buying a $5,000 deductible policy, essentially self-insuring. They buy the practice, all right, which is roughly $800 a year. That covers 85% of their care. That $4,200 that they have at risk, the average person that's getting rid of his insurance, buying a $5,000 deductible policy, self-insuring, that $4,200, Clay, they have saved and banked in 6 or 7 months, and their insurance costs go down 30 to 50%.
In addition to that, they can put money into the health savings account, up to $6,350 for a family, or about $3,000 for an individual.
Tax-free.
Which tax-free, and it accumulates tax-free.
It's pre-tax dollars.
So that will cover the deductible.
Oh, yes.
And your cost.
Yes.
Well, and then the other thing is, if you're looking at prescription coverage, for, like in my case, my wife has a lot of prescriptions she takes. If you're looking at that much of a savings on prescriptions, you can make up the difference in just the prescriptions alone.
Well, we have a lot of people that buy the prescription coverage, and what we usually do is tell them, go over to our pharmacy. He'll tell you right up front, is it worth it or not? All right, and I think most of the time it is, and then they spend the $44 a month so they can get those discounts. But if you look at the prescription coverage changes, you look at imaging. I'll tell you another story that happened in the office. But I have a patient that he has insurance. I followed him from my previous practice. He followed me, and he needed an MRI of his neck. He has neck troubles. I mentioned, he has insurance. I really didn't think about it. And I mentioned we're going to need to do an MRI of your neck. His wife just burst into tears spontaneously. I was kind of almost, what did I say wrong kind of thing, Well, make a long story short, 6 months earlier, another doctor had ordered an MRI of a different part of his body. His copay, Marty, is $2,400. They're still making payments on their copay for the MRI.
Wow.
He joined the practice, paid us $69 a month. You know how much his MRI was?
How much?
$340. Now, there's a price to pay. You know, I think he had his MRI done at 8 at night. Those expensive things we schedule. They're scheduled when they have off times and things like that. You know, if you're going to call up Monday morning, I want my MRI 9 o'clock Monday morning, you'll pay the $3,500, $4,500
Right.
it is. But it's well worth it.
Well, I understand that next year practices like yours are going to be eligible to be in the exchange.
That's true. The Affordable Care Act had the only practice model that is allowed to compete on the exchange is a direct payment care practice like ours. And we're working on that right now to go on the exchange.
We're having a conversation with Dr. Mensink from The Practice.
But my concern would be, is that going to qualify for the essential benefits that are required under Obamacare?
Well, we are already covering, I think, 8 of the essential benefits already in the office as we talk. There's just a few more that we have to add.
So basically what would happen then, just to give an example, if you're on the exchange and people go in and buy your product, they meet the requirements for affordability because it's only $69 a month or maybe $70 by that time or whatever. But so the employer will not get penalized at $2,000, the large employers. However, if an employee was to go to the exchange and get a subsidy, then the employer could be fined $3,000 for that specific employee only because it doesn't meet all of the benefit requirements.
That is correct.
This is a type of program that I currently offer to large groups right now. It's about $100 to $115 a month that we give to employers with over 100 employees, or over 50 employees, actually.
Yeah, but there are more cost-effective ways of doing medicine. That's what we're all about. Most cost-effective quality care we can do.
So currently, what you offer is the practice, which is basic services provided to the general public, whether they be blue collar or white collar. You give them prescription drug coverage. You do some of the lab things in your office.
Yeah. Our office is it's a much broader care that we give in our office than most offices, primary care offices. It's probably, in truth, more like an urgent care than most. And we do our own EKGs. We do our own suturing. We do our own epidurals. We do a lot of pain management stuff. We do casting. We do a lot more things than the average office would do. But everything's done to make it cost-effective.
Are you going to expand and offer additional offices? Or
we've already been off. In fact, as we talk, we have 2 offices that we've been asked to look at to see. We're going to see what happens with Obamacare.
Before I get too far into this, let's let people know how they can get a hold of your office so they can get more information directly from your staff and maybe decide to enroll.
They can call 661-871-3300.
661-871
3300.
3300.
Yeah.
Okay.
And do you have a website?
Yes, we do.
What's it?
It's www.drmensink.com.
MENSINK.
That's correct.
drmensink.com. If you haven't checked on this program, it's well worth it, especially if you don't have benefits for your employees or you as an individual don't have it, because as of January 1st, you are required to have insurance. Now, I don't know, is this going to qualify January 1st to eliminate the $95 penalty?
Right now, the only way qualifying right now is to get a health savings account with the practice.
Which is a great concept.
Yes.
It is probably the cheapest way, but you're self-insuring essentially.
Yeah, definitely.
Well, but you're only self-insuring for the first $2,000 to $5,000, and having your program involved with them, there's really no self-insuring. It's fully
cuts
covered.
the risk down markedly. I mean, this is why we're growing, Clay. I mean, it's just amazing what's happening.
Sure. Now, if somebody wanted to join, you're looking at $69 and then $44 on top of that for the prescription benefit?
If you want to get, probably the majority don't buy the prescription benefit.
Right.
All right, but it's $69 a month. That's what you pay.
Right.
We have a discount for families. If 2 parents sign up for the $69 rate, each kid is $20, and then we have a discount for businesses or large groups. As long as it's under the same billing number, it's $69 a month, and then 10% off.
Okay. Now, can you just buy the prescription coverage? Or
No.
So you have to buy
That's
both.
Correct. You have to buy if you want the prescription
looking
plan, you have to buy the practice.
And this is a great opportunity for those of you that don't have insurance to get an inexpensive program. You only have to be in there for 6 months. So if you're not happy after 6 months, you can terminate the program.
Yeah, we have no downside to
Yeah, there is, as Dr. Mensink just said, there's really no downside. And if you need additional information on his program, or you want to talk about Obamacare or individual or group insurance, you can always call me, Clay Koerner, 427-4700, extension 1. That's my cheap plug for the day.
Well, it's I'm glad you're giving that because this is really important information.
Well, let's do it again then. 427-4700, extension 1, Clay.
I'm sorry, I didn't hear that. What was that again?
Let's give Dr. Mensink one more plug.
Okay, Doctor. Your phone number again?
661-871-3300.
Okay. Again, this is important coverage because this is something that we're going to be talking about for the next couple of weeks because we really don't know how this thing's going to land.
Well, who we got coming on? Let's do it one more time.
Well, we got Barry Goldwater Jr. We have Wayne Root coming on talking about it.
Written the Ultimate Obamacare Survival Guide.
And then we have Sally Pipes coming on the weekend of the 18th.
She's written 2 books about Obamacare.
Yes. So,
and we've got more people that want to come on. We can't get everybody on.
Yeah, there's not enough time. Again, Doctor, thank you so much for the time.
And thank you.
We'll have you back.
Definitely. We'll be back in 167 hours on Taking Care of Business on Koerner Radio News Talk 1180.